Thank you, everyone, and welcome to our first Queen Elizabeth Scholarship presentation session for the fall 2018 term. I'll give you a quick little summary at the beginning here, and then we'll introduce our presenters for today's presentation. So here's a quick agenda. I'll tell you a little bit about the McMaster Health Forum, a little bit about our current Queen Elizabeth Scholarship Program, a little bit about our new Queen Elizabeth Scholarship Program, and then we'll introduce the two presenters for today. Stephen and Peter, both of whom went to South Africa, both worked for the same organization technically, but they did quite different projects because of the partners that were involved in those projects they were working on. So, who are we here at the McMaster Health Forum? The McMaster Health Forum aims to be the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders, and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and individual Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Our version of the Queen Elizabeth Scholarship here at the McMaster Health Forum is called Strengthening Health Systems. Our scholars contribute to strengthening health systems and become part of our large and growing network of health system leaders. We now have been awarded a new Queen Elizabeth Scholarship Program, which will last from now until 2021. So the scholars you'll see today are part of our old program, which is just ending. We are now soliciting applications for our new program. So just a note about this new program. It runs, as I mentioned, from now until 2021. This new program is called Queen Elizabeth Scholarship Program in Strengthening Health and Social Systems. This program will be similar in large part to the one that is just ending, with a few minor changes. So one has to do with the location of the internships. The old program, we could only send students to Commonwealth countries. In this new program, we can send them to Commonwealth plus low and middle income countries. Because of that, our partners have changed. We are using the same partners we did in our old program, but we have added two new partners, one in Colombia and one in Lebanon, and there are two other partners that are potentially on the horizon. The focus of the internships obviously has changed a little bit. We are not just focusing on health systems now, we are also focusing on social systems. And because of that, we have expanded the eligibility criteria. So all of the programs that were eligible previously, both at the graduate and undergraduate level, still apply. However, we have added an undergraduate program, those in the arts and science program. And the number of opportunities has changed. Overall, in the previous program, we will, by the end of it, have sent 61 people abroad or have hosted students. In the new one, we will be sending 24 students abroad and hosting 10. So 34 in total. So we've cut everything in half, basically. So with that said, here is the students that were in our old program. So our first cohort, which was primarily in 2016, we had 8 interns, 2 scholars, all outgoing, and then 3 incoming scholars. In our second cohort, we had 1 incoming scholar, 1 outgoing scholar, and then 20 outgoing interns. And then our third cohort, of which our presenters are part of, that'll appear today, we had 10 incoming scholars, 10 who went away in the summer, and then 5 who are currently abroad right now during this fall term. So at the time of his internship, Peter was also an undergraduate student in the Bachelor of Health Sciences program here at McMaster. He has an interest in the macro level aspects of healthcare and healthy systems. During his internship, he hoped to develop his skills in critical appraisal, while at the same time providing a real-world context for the importance of evidence syntheses. And just like Stephen, he is still a student here at McMaster, and he is also in the Michael G. DeGroote School of Medicine. So please give a warm welcome to Peter.
All right. So, hey, everybody. So my name is Peter, and just like Stephen mentioned, we were in South Africa together this summer. So our internship started in May and went until the beginning of August. And we were working for the Africa Center for Evidence, and some of the projects that I was involved with were also either commissioned by or in collaboration with the Department of Planning, Monitoring, and Evaluation with the South African government. I've interspersed a few pictures of our travels throughout this presentation for you guys to enjoy. So this is us at Nelson Mandela Square in San Okay, so during my time in South Africa, I was involved in three main projects. So the first project was working on a map of evidence-informed decision making in Africa. So we just wanted to see, the quantity of institutions that were involved in this kind of work and what kind of work they were doing, what sector they were involved in, and so on. The next two projects were done in collaboration with the DPME, the Department of Planning, Monitoring, and Evaluation, and they were both very large-scale projects. So the developmental state project, I sort of joined in as they were finishing that up. So I was involved in data extraction for grey literature. And then the National Spatial Development Framework is a project that they were just beginning as I was ending my internship. So my work on that was in the very beginning stages of that project. I think these projects will take a year or longer to be completed. So this is, we did a bike tour in Soweto, which is in the southwestern townships just outside of Johannesburg. And it was previously, it is now a place it has been like culturally revitalized, and it was very nice to, I guess see the locals there and the conditions they were living in, and I guess also the historical significance of that. So for the first project that I was working on, the map of evidence-informed decision making in Africa. So the end goal was to create a visual map of evidence use in Africa. And so as a part of this, my task was to sort of compile a list of institutions that used or were a part of evidence-informed decision making based in the African continent. And then after that, we needed to take that list and have it hopefully in a way that was searchable visually based off of several parameters, so that we could see that information visually in a way that was very easily accessible. So we started this using a Google search, and we used several terms to be able to find these institutions. Now, as a part of ACE, which is the Africa Center for Evidence, they also run something called the Africa Evidence Network, which I will mention briefly. But this is basically it's a network of institutions and individuals who have an interest in evidence synthesis and evidence-based decision making in Africa. So they also had a database of people that we cross-referenced while we were getting this data. And so early on, while we were extracting the data, we realized that there was sort of a mismatch. So for example, while I was doing the Google search, about 70% of the institutions that came up were South African, whereas in the AEN, there was only about 40% South African institutions. So we knew that our search wasn't effective and that it wasn't really gathering all the institutions that we wanted to. So we did a second search with more words, as you can see, more search terms, as you can see down there. And still, we couldn't find all the data, all the institutions that we thought were out there, or that we knew were out there, just based off of, I guess my supervisor had a very extensive knowledge of what was out there because that was his discipline and his field. So we went through the AEN and gathered some data there. We also did a little bit of a grey literature search and consulted some other experts to make sure that our list was as comprehensive as possible. Now, at the end of that, our list was maybe a little bit too comprehensive, so we needed to be a little bit more stringent and narrow it down on our inclusion criteria. So although at the beginning we had it so that we would include any African-based organization whose core mandate was evidence-informed policymaking, we needed to be a little bit more strict on what we were excluding, just for practical reasons, and to make sure that the map was really showing what we wanted to show. So I guess I'll go through two opposites of different kinds of institutions, which are the last two in the exclusion criteria. So for example, we wanted to make sure that the institutions had that core function of evidence-informed decision-making or policy-making. So if you look at some government departments, they are definitely involved in policy-making, but unless they specifically mention the use of evidence or evidence synthesis, then they were excluded. And then on the flip side, research centers and units who were just involved in research synthesis and not necessarily in mobilizing that research to policymakers, those were also excluded. So we ended up with a list of about 250 institutions. After our more rigorous screening, we ended up with a list of 90 institutions. And from these institutions, we then started to extract data. And we extracted data from a variety of different things. So obviously we wanted the name of the organization, but we also wanted some more information. Some of it was for practical reasons. So for example, a website, or the latitude and longitude, those things were more for functional features of how we wanted to present the data, because we wanted to put it on a map. Other things, such as the country that the institution was operating in, were important because, as you'll see in a second, most of the institutions are clustered in metropolitan areas, but they often cover a wide range of areas that also span many countries. So it was very common to see, for example, institutions whose work, although they were based, for example, in South Africa, their work really covered all of Sub-Saharan Africa or Southern Africa or Francophone Africa, and so on. We also gathered some other information, such as the sector level policy making, and also some descriptions of those institutions and what they describe themselves as wanting to do. So in our final list, it was very easy to tell that most of the research that is being done and most of the work in evidence-informed decision-making that was being done was done in South Africa. And that was something that we expected and that we knew going in. And you will see this again visually in a few slides. In terms of sector, I was surprised by this. So I was expecting health to be the largest sector. I guess maybe that's just biased because of my own background in health. But the largest sector was in monitoring and evaluation and ensuring that programs that governments have put in place are sort of being assessed for their impact continuously. In terms of level of policy making, most of the institutions worked at the national level. So that just means they were working with national governments and federal governments as opposed to more local areas. So back to the goal. So we compiled all of this data. But really what we wanted to do was we wanted to have a map of evidence-informed decision-making. So we did a search of a bunch of different softwares that we could use. At the end of the day, though, we decided to use Google Maps, and we put all of the institutions as pins based off of their location on this map. And you can click on a map. So, for example, here I've selected the pin for the Africa Center for Evidence, and there you'll have information on that. You can access the website there. You can see a description of the kind of work they do, the sector that they're involved in, and so on. And this is completely searchable. Okay, so while we were in South Africa, we had the opportunity to go to Kruger National Park and do a safari, and we got to see lots of animals, which is very exciting. So we saw elephants, we saw zebras. We went on this sunrise hike, which was very early, but very enjoyable. All right. So the second project that I was involved with was the developmental state project. And as I mentioned before, I was joining this at the end of the project. So the bulk of the work had already been completed at this point. So, to start off in explaining this project, I'd like to sort of explain the concept of the developmental state, because certainly this was something that was very, very new to me. So this is something that stems from the political science literature and was evidence or it was a phenomena that was observed in the East Asian tigers, Hong Kong, Singapore, South Korea, and Taiwan in the second half of the 20th century. And basically these countries were able to take the initiative to create policies that directly promoted the development of that nation. So I put macroeconomic development because originally the term was used in an economic context and to sort of promote economic growth in those countries. But now I think the literature has grown to include just development in general. So really just taking an initiative to create policies that in the long run will intentionally promote the development of the nation. Now, so what we were trying to do is we were trying to see how we can apply the developmental success stories of these Asian tigers in a country like South Africa. And that definitely did present some issues, and some of these were very explicitly known from the beginning. So, for example, most of these countries had a sort of communist or authoritarian government during that time, whereas South Africa is now a democracy. So there was a lot of literature debating whether or not a democratic government can be a developmental state. But basically, the government wanted to see how the South African government can take initiative in its own development. So I was involved in doing the gray literature extraction for this. So we originally started with 410 articles. We excluded everything that did not have to do directly to the developmental state. So, for example, there were some articles that were like referring to a psychological developmental state. So we were focusing on the political economic concept of the developmental state. And we also needed to make sure that it was discussing the developmental state and recommendations to how South Africa in particular can become a developmental state. So that at the end of that, there were 109 papers that I extracted data from. And the data that I extracted based off of the extraction tool we were using was in 10 different categories. And these categories, as you can see here, they're very broad, they're very different. Unsurprisingly, most of the papers revolved around economics. However, there was a few papers around general public services, a few on housing, a few on education. Now, for me, I think this was a very interesting project. So for me, whenever I had been thinking about development previously, it had always been in some sort of specific context, for example, education or health, because of my background in health. So I think this project really showed me how development is really interdisciplinary as well as interconnected. So all these things sort of go hand in hand. So these 10 different factors all sort of affect each other and influence each other and really give a holistic picture of development. I also think it was at the beginning a challenge, but I think also very rewarding for me to be able to be exposed to a breadth of different kinds of literature. So when I was doing the extraction for this, I was reading lots of papers in economics and political science and education, and that was something that I had not been exposed to before. And I think that was important because I can see now that I have this understanding of development being very interdisciplinary, very interconnected, thinking about my own career in health, about how it's important to be able to go through other disciplines and to be able to draw on the literature in other disciplines to be able to inform policy in health and in the health sector. So that brings it back to my own, career and background in health sciences. So this is Table Mountain in Cape Town. We hiked this on a very exhausting day. When we got to the top, it was a cloudy day, so we couldn't see anything. So it was sort of very anticlimactic after all that work. Close to Cape Town, they also have penguins, which was very exciting to see. I was surprised that South Africa had penguins, but I had known that Steven sent me a link of penguins in South Africa, and I was really excited to go to see the penguins. All right. So the last project that I was involved with is the National Spatial Development Framework. So basically, the government has identified that 20 years after the end of the apartheid, that spatial inequality remains persistent in South Africa. In fact, some of the figures that they were showing suggested that really there had been no change in spatial equality and in the sort of the segregation that exists. And they often gave the example of two neighborhoods in Johannesburg. One is Sandton, and the other one is called Alexander. And Sandton, if you search it up, one of the keywords that you will hear about is or see used to describe it is opulent, and then Alexander is really really they really told us to like avoid that area and that it was like dangerous and has high rates of crime. And it really is a high contrast in between, I guess, it's a good example of the inequality that continues to exist, and it's very evident because they're so close together. So the NSDF, the National Spatial Development Framework, is something that is a project that the government is starting to implement or to work on now. And they are hoping to create a framework to inform spatial policy in line with the National Development Plan. So South Africa has this National Development Plan to achieve certain goals by the year 2030. And so this sort of falls under that and is hoping to support the national development of South Africa, specifically in terms of spatial policy. So what I was tasked to do for this was to look at a data set that they had previously used for another evidence map that they had created on human settlement. So this had to do a lot with housing. And so because of that, it was very spatially oriented. So I was tasked to look at this literature and see what kind of data sets they were using and where they drew on the data. And I think we were surprised by the results a little bit. So there were 142 articles in this evidence map, and overall, there was not that much evidence, not that much spatial evidence. So a big bulk of the evidence was qualitative in nature. A good chunk of the studies had no reference to external data. Some of them were just policy reviews written, I guess, more by academics and were more theoretical in nature. And only 22% explicitly referenced external data sets that they based their research on. So I think it's difficult, and one of the challenges that we hypothesized is that because spatial data is difficult to collect, one of the easier ways if you're going to have a spatial project is to conduct a case study. And we found that in the literature that there were a lot of case studies. But these case studies were often based on qualitative data. And while qualitative data is definitely useful, it was definitely, the literature was definitely skewed towards qualitative data, and there were no quantifiable outcomes or measurements to base decisions on. This data also was mainly segregated into two rough categories. So there were very high-level economic data. So, for example, like their South African census and other large projects like that collected data at a very high level. And the problem with this is that this doesn't really help, for example, municipal governments when they're looking at their own development projects, or also provinces. So the data wasn't segregated by levels of space. And the other one was household surveys. So household surveys, a lot of these were by consulting companies or specific NGOs that were looking at like development for a project that they had done. So to address this goal, what we were trying to do is create a database of spatial data that was also represented spatially, so that policymakers could access this and say, for example, they had a question about like inequality in education or inequality in different schools in the area around Johannesburg, that they could consult this data and look at maybe some different stats like on a map and be able to see that. But the problem that we realized is that there is just simply a lack of spatial data. And I think this is something that they are actively working on. So this project was very interesting to work on because I got to attend a few meetings with at their parliament building. And there were many officials from different levels of government, as well as from Statistics South Africa, about how they're collecting data and how I guess the future of their censuses might work, or what changes they can do so that they can further inform this. So it was very good to see, I guess, the process of research and how it can take a while, to create effective change when you're dealing with something where it's difficult to have that data. So this picture is taken from the Garden Route, which is along the southern coast of South Africa. All right. So those were the three projects that I was involved with, and I think the main takeaways that I take from my time in South Africa, as James mentioned, I really wanted to gain an understanding of how the politics and history of the country really affected health, and also, as I learned, development and other factors as well that were all interrelated. And I think that during my time there, it was very eye-opening to see how pervasive that inequality was, and also it was also interesting to see that South Africa is really like a nation that is like really like starting to boom. Everyone's sort of talking about politics. I'm talking with Uber drivers that everyone had or was involved or had something to say, which I thought was very positive, and I really learned from everyone that I interacted with during my time there. And most importantly, I think it was a very good opportunity, and I made some great friends who I still keep in touch with.